We're going to begin today with talking about registries for all for individuals. We've looked at it from a number of points of view, but now we're going to go to what individuals need and what we think that they, in fact, might want to share. This is Sharon Terry. Genetic Alliance has created this tool, and we are looking at it as a very open source, open access tool, one that we want to have a lot of people use, and so we're very excited to share it. I'm going to ask our technology folks to actually take you guys off mute. We usually don't do that because there's usually too many people, but today we expect about 40 people, so that should not be too overwhelming. And I'm going to do that so that you can ask questions as we go, so that you don't have to be typing them in, although you're also welcome to type them in. While I give the presentation, you can type them in. You also can feel free to interrupt me as we go. Either way works fine. So I'm going to tee up the slide deck and make sure that you all can see it. Occasionally, there we go. Can we make sure, Tanya, that that's just the presentation mode and not the note mode? Thanks. Sorry, just a little technology issue. And could you take people off mute, Tanya? Thank you. Great. Okay. Okay. So as I said, we have looked at Reg4ALL through a whole host of lenses, and I encourage you to go to our archive on our website, which is geneticalliance.org/webinars, and look at the Registry for All webinars, because we've taken a deep dive into each of these, and we certainly hope that those of you who are coming to this today have looked at some of that or have been present on those calls. As Tanya unmutes your lines, if you could mute yourselves, that would be really helpful so that we don't have a lot of static or noise. But again, feel free to interrupt me because there will be only about 40 of us on this call. So we've noticed, like everyone else, that there's a lot of problems in healthcare today, and it's probably the biggest issue facing America. And while certainly other issues do become very important over time, we are noticing that the expenses associated with healthcare and the lack of progress in terms of translational science and treatments and therapies and diagnostics and interventions is really troubling. And so this huge, huge issue facing us today, 20% of our gross domestic product goes to healthcare. And as Tanya unmutes you, if you could unmute yourself, that would be great.
And for some reason, the tissue bank mailbox is not there.
Can we have whoever that is
Yeah,
mute,
is it on
please?
here now?
No, it's always been on here.
Oh,
I mean, my whole...
Thanks, Tanya. I think you muted them again. Okay. But the problem is that we need to hold down costs and also find a way to ensure those who are underserved and who are not insured. Many contend that the quality of care provided by the present system must also be improved, and as many as 100,000 Americans die in hospitals each year through preventable errors. Adverse drug reactions result in 2 to 3 million hospitalizations annually, and many are really concerned about how many years it takes for a new compound to come to market, and we all know the stats that say 95% of those fail. So there's a whole host of things that we think are problems. Now, some have contended that technology is the solution and that electronic and personal health record systems may reduce costs and improve care. We know there's also problems with those solutions as well. They're very hard to interoperate. There's lots of good efforts going on in the Office of the National Coordinator and elsewhere to do that. Blue Button Plus should be coming down soon, which will allow us to download information in a form that's readable. And most Americans support this approach, but there are rising privacy concerns. How do we share this information in a way that's sensitive to the individuals who own it? We know that one-stop shopping does not work. We have done lots of studies, and I'll talk about those in a second, that show, in fact, we all have different sensitivities about information. I have 2 kids with a genetic disease that since they were little has been very public, and because I've worked in the disease community, I've wanted as much or who don't yet have a disease and are interested in privacy as well as being able to be participating in research. So some of the studies that we've looked at are over 85% of persons surveyed in a recent Harris poll said they believe protecting the confidentiality of their medical records is essential and important. Over 60% of consumers want explanations up front. What we've noticed is this issue around the right to control, and the way that I think it's best simply put is, in fact, if I went to your house right now and took your bicycle and rode off on it, you'd probably be pretty surprised and kind of annoyed. If I asked you, may I borrow your bicycle, you would probably say sure. And so basically we're seeing the exact same thing happen with regard to information. We're seeing the same thing happening, in fact, in the discussions around whether or not our metadata from our phone calls should be public, whether my browsing history on Google should be public, that sort of thing. And if I understand why and I understand the extent to which it's used, then I might say yes, I might not say yes, and both of those need to be respected. And then over 80% of individuals want to be able to review who has had access to their data, and then up to 80% of clinical trials experience problems with recruitment. And this is quite remarkable. There's a paper out of the University of Oregon a couple of weeks ago that essentially shows that most of their trials, and they were kind of bold in being able to put this together, most of their trials are in fact recruiting very, very poorly, and they call an under-enrolled trial less than 3. So the bar is very, very low, and still they can't meet it. So Registries for All is all about access and privacy, and sometimes I write this as access and sharing, in fact, because we're not interested in just protecting privacy. If we focus just on that, we're not going to get to where we need to be. So we need to understand access, privacy, and sharing, and then some other nuanced things that I'll talk about in a second. But essentially, what we're doing is empowering people with tools that ensure that their privacy concerns will be taken into account and respected. I would add that their sharing concerns are going to be taken into account and respected. There will be ways for them to share. So we get individuals, for example, who are involved in a clinical trial and really wish their data was shared beyond that trial, and it's not. So if they're in a trial with Lilly or Pfizer or whomever, that data stays in that trial, and even when the trial's over, the data is not available to anyone else. And we've heard from individuals, wow, it was a lot of work to be part of that trial. My own daughter's in a trial at the Mount Sinai Hospital right now, and really wishes that that information could be used in other trials, and maybe even for other diseases, for comorbidities. So we're trying to figure out how do we allow individuals both to have their privacy concerns met, but also to have their sharing concerns met. And that participants can assure and want to assure that their requests for access and transfer of their relevant records are promptly filled, and Reg4ALL certainly gives them some of that view. We're also very interested in seeing how can we all start to take a very active role in our health, that we pretty much want life to go like this. I get diagnosed with something at the doctor's, or he finally figures something out. I go to the local pharmacy and I pick that treatment up off the shelf and I walk out after paying for it, of course. That's often not what happens, and those of us who live with chronic diseases, with cancers, with type 2 diabetes, with Alzheimer's, with Parkinson's, with many rare diseases, we know that that's not what the world is like. But we don't understand that before we are in the situation where we don't have a solution. And what we're trying to do is have people understand well in advance of that, that if each of us is safely sharing our clinical information, our health data, then we're actually going to be able to be ready to have solutions when the time comes, and not all of a sudden, like I faced certainly with my children and many of you on the line have faced with various diseases. I need the treatment today. It's 1994 in my case, and there's nothing. And still in 2013, there's nothing. And we march to get ready for there to be something, and we're around the average time of there being something, and we have a clinical trial. But wouldn't it have been better if we were aggregating things well before this point? And we want to do the same for the next person that's diagnosed, that they don't have to wait years and years. So the other piece of Reg4ALL that's important to us is that we actually are figuring out a way to have the clinical trial come to the individual. Again, many of you probably have tried to use clinicaltrials.gov, and it's really a super and awesome resource that we have these trials registered so that we can look at them. but it's often very hard to see, do I meet the eligibility criteria? What about this piece or that piece? What about if I'm not finding it because I didn't search properly? All that sort of stuff. And in Reg4ALL, essentially, the trial comes to the individual. And it does so in the process of both using the raw materials of clinicaltrials.gov, and we're very interested in some partnerships that we're working on with others who have parsed that information even better than the government site does. But in addition to that, we have researchers using a portal called RecruitSource. And the researcher is putting in 5, 6, 18, 30, 45 criteria that are important to him or her, and then getting back individuals who have raised their hand essentially to say they want to participate in research. And therefore, those individuals are pre-matched. They're ready. The researcher put in the criteria, that these individuals match that criteria, and now the researcher may be able to contact them. And what the researcher will see actually is a whole host of information in a bunch of forms. So they will see de-identified information that says, yes, this person has pink toenails, green hair, and lives in Arkansas. And that's exactly what I need for my trial. They'll see some of that big pool, and maybe let's say there's 400 people in that pool. Half of them have said, yes, you may contact me. And so what they see is a pseudo-anonymized key that allows them to send them an email and say, I'm looking for exactly what you have. And so would you contact me back and participate or not? And then a smaller subset of those individuals have already said, use my data. I've raised my hand to the point where I've said, everything's free and open. You can see everything. I'm fine with you using my data as it is without even asking me. The system provides an audit trail, and so individuals, whether or not they've required that the researcher contact them, can see the audit trail, and they can understand who has access to their information. About 57% of Americans state that the right clinical trial, if it was there for them, they would be interested in participating. But right now we know that less than 5% of Americans are participating, and about 5% say they know how to find this information. So it's not so much that the public is unaware, it's the public doesn't have an easy, frictionless way to participate in clinical trials. Reg4ALL allows the individual to compare themselves to others. And what we found out about people, and I think we all know this, we know it both from our own lives as well as from the work we do, is that individuals want to be the same as everyone else, and they also want to be different from everyone else. We both want to be unique, and we want to belong. And so with this kind of system, what we're doing is giving people feedback right away to allow them to be able to see how they stack up against someone else. And so in the picture I have on the screen here, the question was, I deal with stress, and the continuum is not well at all to extremely well. And basically I put myself on the line in the form of that little red slidey thing at the bottom, and it says, gee, I'm in the bigger bolus of people. 63% of people are either where I am or dealing better. 37% aren't dealing as well. And so I can compare myself to others. I can, come back and answer these questions later when I've made some adjustments and see how I stack up against others. In addition to this, you can also ask your own questions. So often I think, particularly people living with chronic disease, and that chronic disease can be common or rare, feel like the medical community is not asking the right question. The medical community, of course, may be focused on a very important question like, how are we going to find a treatment for this condition? But meanwhile, the people living with it often want some very simple things that are quality of life related, or might be the way a drug is administered or an intervention is taken on. It might have to do with adverse events from medications. And so this system allows the individual to actually input a question themselves, or many questions. So they can put in questions they think are important about the disease or about something in general. And what the system does itself is it allows individual questions to be essentially crowd-sourced and crowd-voted on. So in other words, if I put in a question that says, do you feel on Wednesdays at 2 p.m. that you should run around the block? That's probably a pretty silly question, and there won't be a lot of people either answering the question or answering yes. And the system will suppress the question over time. If, however, I put in a question that says, I have psoriasis and I find my itching increases somewhere around dinner time, that's probably a more relevant question, and the question will start to be answered more and will also start to be put more toward the top of the questions. We also have the system built in such a way that whether it's disease groups or researchers themselves, that those questions can also be curated and ordered in a specific way so that the disease is actually being, a disease question is actually being served. But in the about 15,000 diseases and their subtypes, and the now about 40,000 questions in the system, much of it is essentially crowdsourced in the sense that people are voting on what's happening here. So I'm going to go to this slide later because it's about our upcoming webinars, and I just actually want to show you a couple things live. So the first is that you can come to Genetic Alliance's site called Disease Info Search, which I'm on now, and I hope everyone can see. And in this case, I've searched for liver cancer. So this site has 15,000 diseases and their subtypes. It has support organizations. It has general resources. It has scientific literature. These are drawn from PubMed and filtered so that more of the useful articles and some of the free articles come up first. It has information pulled from Genetics Home Reference and the Genetic Testing Registry, and then it has clinical trials information. According to clinicaltrials.gov, there are 630 open studies in addition to the ones that are being displayed here. Again, you can go to these and make choices, or you can do something like go to this Trials Finder, which I'll go to in a second. But one of the things that we're offering also is the opportunity to be engaging with the site and not just reading the site. So yes, I've been diagnosed with liver cancer, or no, I haven't. I will get immediately some result. I'll then get some questions, what size or stage is my cancer, and I'll answer that question. And again, I can see how I stack up against other people who have answered that question here. Some of the questions that come up then are about things like quality of sleep. What we're doing here is mixing up the questions in a way that we hope is enticing. We're doing a lot of testing around whether you would go straight through a set of liver cancer questions in this instance, or whether you would get other questions like these. And see, again, how do you stack up with other people? Here's that stress question, and so on. And even interestingly, that you can see that the average has changed for the stress question. We took the screenshot about a week ago, and lots more people are in here, and lots more people are answering, and what we're seeing actually is that the average is somewhere around average, that people are dealing with it less. I can also change my answer. It will start, the system will ask me, are you trying to change your answer, and it will let me do that. And I can also say I don't know, or I want to skip the question. It's asking me, do I want to change it? I can say yes, and go back to the question and move it. Again, these questions can either be targeted because a disease group has been interested in targeting them, or a specific study, or they can be very general. And if you came in through any of the diseases here that we have not yet curated, you will get the general questions. Okay, we have a number of ways to get into the system. Another portal for it is this called Trials Finder. And Trials Finder essentially does what it says, and it's essentially the same as the other sort of skins I'm going to show you. And if I say, yes, I've been diagnosed with a condition, I can then say, let's see, I have been diagnosed with epidermolysis bullosa, so I can just type in a few letters and it has one of those lists that come down. I can say I have multiple diseases, so if I could spell, I also have psoriasis, and then I can say done. So now that I've given it a couple of ideas of the diseases that I have, the questions that start to come up will be ones that will be selecting those conditions. So that's Trials Finder. We're also running, I'll show you actually Reg4ALL itself, but again, very similar to what you just saw. Reg4ALL is the sort of vanilla brand of the website. It isn't branded with anything except its own brand. and it allows lots of the same kind of functionality. It's agnostic to disease. It's even agnostic to having a disease. You don't have to have a disease to do this, and it essentially engages individuals. What we've been finding is that individuals actually stay working on the site's questions somewhere between 10 and 20 minutes because they find this sort of gamification, letting me see how I stack up against others, very interesting and very easy to use. You can see that it's very quick. Obviously, I'm not even reading these questions, but it's allowing me to answer them and to see how I compare. And if I want to go back and look at something, I certainly can. And once I make an actual account, so if I keep going, it comes to this question that says, I would like to create an account right now. And if I say yes, then it will bring me to an unexpected error. Isn't that lovely? Some of my team, if you could please contact the site administrator. So usually you'll be given a screen that will allow you to sign up, and the sign-up screen looks like this. I enter my email address, and it functions very much like all those other sort of very secure sites that you go to. Essentially, it will give me the opportunity to go to my email, to then set up a password, one of those little pictures that your bank asks you for with a phrase under it, because in fact we are using software that comes from one of the major banking systems for that, so that it's very secure. And then the last skin that I'll show you is this Free the Data site, which again is very much powered by Reg4ALL. But in this case, what we're doing is we're asking women who have been diagnosed or who have been found to have a BRCA1 or 2 mutation for them to upload their report about that variant, and also to answer some questions about breast and ovarian cancer, hereditary breast and ovarian cancer. So this is done in partnership with a number of other partners. Our partners are right here. So we have Invitae, which is a company in California, the University of California, San Francisco, specifically Bob Nussbaum, Beth Crawford, some other people working there, and then Private Access, which is the company that powers all of the. And here our intention's a little different. We're not building, well, we are building a registry, but that is not our specific concern, and we're also not, our first priority is not to match individuals to a clinical trial, but instead in this case we're looking at how do we get the variation in these 2 genes, which right now is proprietary. It's owned by one company in a massive database. How do we get it into the open? How do we get that into a commons? How do we get it into a general database? The one we're using is ClinVar, which is at the National Library of Medicine, NCBI. And what we're having happen here is that we hope that a good sizable portion of the nearly 1 million men and women with mutations in these genes will upload their reports, answer these questions, and then they themselves or their clinicians can search that database. And when the next person gets back a variant report, they'll be able to tell whether or not that variant in fact is disease causing. It will help the hundreds of thousands of women who are in underserved communities who often get back something called a variation of unknown significance. And so, again, a totally different use here, but the same engine underneath, where when, of course, I click the survey, I get a response. And in this case, so far, 78% of the people who have come here, in fact, do have a mutation in that gene. And then my next offer here is, do I want to anonymously contribute the data contained in my report? Or I've already contributed it. And individuals, again, will be able to contribute that information and to set up privacy preferences. And in this case, it's asking me to upload the file because I just chose that. Okay, I think that's all I have for an introduction to this topic, because I do want to leave a fair amount of time for conversation. And again, this webinar is meant for us to be able to talk about this from the point of view of individuals and not from the organizational or company perspectives, because we do have, in fact, have either gone before this one or that are coming up, and we welcome you to those webinars. So, questions. And I do have some that were written in, but I want to just see if there's any live ones before I get to those. Okay. So my tech person, Palpier, just said she can't unmute you because I guess most people called in by their computer and we're getting a big feedback loop. So if you wouldn't mind, in the question box on the control panel, go to webinar control panel, you'll see a box that says questions. If you wouldn't mind typing them there, and I do have some that were typed during that time. So sorry about that technical difficulty. It works better when people call in by phone, but we didn't tell people to do that. I really apologize for that. So I'm going to go forward with a couple questions that have come in through the typing method, and then again, as you have questions, type them in, and I'll read them as quickly as I can. So the first one is, can individuals contact researchers themselves, or do they have to wait until they are contacted by a researcher? Great question. So the way the system is set up right now, the individuals can certainly be still searching for clinical trials, but we are trying to be proactive in this system to allow the individuals to actually make choices ahead of time about what and whom they want to be contacted by. And I should have actually teed these up ahead of time, but I'm going to go ahead here and actually show you a screen. Let me just find it, but I'll keep talking while I do that. So individuals are actually given the option of looking at which place they would like to give their information, and then which researchers they might want to be seen by, and that allows the individual, therefore, to make an effort to move toward a researcher themselves. So let me just stop talking for 1 second, because I will find this deck and be able to show you. Okay, here we go. It's a prior webinar that I just think illustrates that better than my just talking about it. Okay, so let me put this full screen. So you can see here that individuals are given these options, and essentially the options go like this. Who can discover my data, who can contact me, and who can use my data. So these are my privacy settings. And so in the first category, I'm given the option of advocacy and support groups, disease info search listed organizations serving my condition. So again, these are in that database that Genetic Alliance runs, or nonprofit organizations serving my condition, whether or not they're in the disease info search database. And I'm saying here, allow them to discover my data. Allow them to contact me if they're already listed in disease info search, because I know Genetic Alliance does really good vetting. They have to have a board of directors, they have to have medical advisors, they have to be a 501c3, and so on. But ask me if you're coming from a nonprofit that's serving the condition that isn't in disease info search. And then my next category is medical researchers. So researchers recommended by one of these organizations in disease info search. So, you know, it might be the National Psoriasis Foundation or the DEBRA of America. And I know that, again, they are vetted organizations. They have researchers that are recommended, and so I want to allow those to contact me. In some cases, I'm saying allow them to use my data even. I don't even need them to ask me to use my data. I can allow them. IRB-approved researcher addressing the condition. Well, IRBs are pretty good. They are a good way to say something is useful or not, and so I'm allowing them. I'm telling them to ask me if they want to contact me. I'm not just going to show my information. And then all researchers, well, they can discover that I'm in this database, but they can't, for example, just contact me outright or use my data, because that's pretty broad and I want a little control. And then we also have some data analysis platforms, compare with others feature, which you just saw, show related content feature, Genetic Alliance Translational Research Network, the Oracle Health Sciences Network, and some newly released data platforms. And so you have an opportunity to decide what do you want to share, how do you want to share it, and with whom. And so, for example, disease advocacy groups that are using this as their platform for registries would have a lot of the various projects they're interested in listed here, and not some of these general ones. Although an individual could do a deep dive and get to some of these individual ones if they want as well. Okay, another question. So a simple, whoops, sorry. I'll leave this up and stop playing with my mouse. That's hyperactive. Someone asked, can you watch the previous webinars? Absolutely. Those are at, I believe, let's see if we look at the, I don't want to end the webinar. I want to just go back to the other slide deck. I think our webinars are /webinars dot Reg4ALL, not /Reg4ALL? Okay, /webinars. Tanya will actually type the URL into the box and you can all see it. And everybody will be able to get it. Can you make the selection of willing to travel to studies? So certainly you can put your information in such a way that somebody who is looking for someone in a certain radius will see that you override that setting. Yes, that can happen. Will Reg4ALL have the capability to show a list of clinical trials available for specific diseases? So we are working with a partner that is able to do that in a very dynamic way. We don't want to do it straight out of clinicaltrials.gov because that we see as a problem in the sense of understanding criteria. But our desire eventually is to machine automate matching individuals and clinical trials per the information they put in here, and at the same time also to automate the questions that come out of the clinical trials system that would match the individual. So in other words, both directions are things that we want to be able to enable with this system. Another question, what is the cost of Reg4ALL for individuals? It's zero. We really feel this system should be enabling individuals to use it, and there should be no cost to the individual because we want to encourage individuals to be engaged in clinical trials and in registries with no cost to themselves. Next question, can I upload my electronic health record now or my electronic medical record now? So the answer today is no. We're hoping very shortly, and we're in fact actively looking for funding in this regard, at least be able to connect something called Blue Button Plus, which is a project of the U.S. government to allow individuals to download their information in a machine-readable way. So what we'll do is we will have capacity to bring that into this system, and then to allow individuals to set their sharing and their data access preferences vis-a-vis that information. Next is, I have a family member with chronic disease. Should I join Reg4ALL or only people diagnosed with diseases join Reg4ALL? So there's two parts to that question. And so you can see right here this tab says Sharon, and if this was a live, whoops, I messed that up. If this was a live website, instead of just a slide, I could click this and it would show you that maybe I'd also have Pat, my husband, Elizabeth, my daughter, and Ian, my son, and that would in fact allow me, if I was given permission by them, to put this information in a place that, to put their information in the same place. So I can be managing my family, or I might be the caretaker of a person. I can be managing their information as well. And then the second part of this question actually asks too, it's my relative has a chronic disease, I don't. This is disease agnostic, so we would really like people who have no diseases to get in here now. To be available to be controls would be one thing, or in fact to be prepared for the day if and when they would in fact need a system like this. Next question, is there an evaluation plan for Reg4ALL including potential benefits as well as any unforeseen adverse events? So the answer to that is yes. We are quite lucky to have this overseen by something called the BioTrust Ethics Team. So this project lies within a division of Genetic Alliance called BioTrust. The name's very important to us. It says we are building this in a trust system. The BioTrust Ethics Team is led by Kelly Edwards at the University of Washington. It has about 10 people on it, including Jane Kay from the UK, Kieran Doherty from Guelph University, David Winikoff from Berkeley, Suzanne Vernon, who comes from the CFIDS advocacy organization, Greg Biggers, from Gina Mera and Genetic Alliance, Nick Anderson, who comes from the University of California, Davis, Lila Jamal, who's at Johns Hopkins, and so on. And these individuals are very interested in understanding what are the benefits and what are the risks of a system like this. We are working now to put in place how we evaluate that. We're very interested, for example, in looking at the experience of the women who are going to be using, Free the Data. We're also really interested in understanding what are the limitations of this system. We certainly already know there's huge limitations in a digital divide sense, and we're trying to understand how can we make this a text program, since text programs seem to be working in health experiences for individuals in underserved and rural and more underrepresented communities. One of the sort of drawbacks here is that if an individual enters the system and says, do not allow anyone to find me, do not allow anyone to contact me, do not allow anyone to use my data, we can't even use their data then in order to study why they said that. So in other words, we don't have any ability to study people who have decided to close down their preferences completely. That is because we don't have any access at all to that data. And further, even when the bioethics team, the ethics team is studying what's happening here, they have to have IRB approval to do that because it has to come in as a truly well-regulated IRB-approved study. Another question, is there a cost for researchers to access Reg4ALL? So yes, the answer to that is yes. We've got to find a way to make this sustainable. We believe, and the ethics team has really been wonderful about this as well, that it is unethical to have an unsustainable system. One of the things we're trying to do, though, is to understand how do we actually change the equations that currently exist. And so right now, for example, researchers in academia spend between $1,000 and $5,000 per participant, recruiting participants for clinical trials. In industry, it's between $5,000 and we have heard as high as $40,000 per person to get an individual who qualifies from a practice into a clinical trial. Those are obscene numbers. Even $1,000 is an obscene number. And we're basically looking at this system to say, how do you turn this into an app store model? Essentially, how do we make this 99 cents, $1.99, $2.99, so that it's breaking the current system and the current economics of the current system in the sense of not hurting anyone, not hurting the researchers, not hurting the companies, but instead saying, let's put that money elsewhere, because researchers in academia or industry would much rather be spending those dollars on actually looking at how to solve the problem of the disease and not finding the people to study for the disease. And so we're looking at ways that that we can change the equation there and hopefully change the research paradigm as well. Next question, and I should tell you I'm just reading these questions out and answering them as I go, so I'm not preparing them in any way. What difference or association with NIH registries for rare diseases? Okay, great question. So in some cases, the NIH registry for the rare disease is on this page. So this is a funnel, this is a pointer, this gets an individual into those registries as well. In other cases, individual disease groups are using this system for their rare disease registry or their common disease registry. We don't really care. It's like we're agnostic to how many people in the world have the disease. And then specifically formally with NIH registries for rare diseases, Steve Groth is very aware of this project. He's been very, very supportive of it. He likes it as an option for disease groups. It doesn't interact with the Rare Disease Research Network registries yet. We are hoping at some point it certainly can, because again, they can be listed on this screen, and we're very happy to have that happen. Next question. What kind of verification process do you have for researchers that will have access to my health data if I choose to share? Great question. So right now, researchers go to something called RecruitSource, and I don't know, I keep doing this. Cancel. I don't want to stop the webinar. I just want to get out of there. So right now, RecruitSource, researchers will go to this portal. Sorry, I'm on our wireless, and sometimes that takes a minute. And what RecruitSource will do is allow them to sign up and to log in, first to register, then to log in. When they register, that registration comes to Genetic Alliance, and we take a look at the registration. And in the registration, we ask a whole host of things that give us some of the kind of normal pointers to credentials that individuals would have if they were truly researchers. And one of the things that I'm fond of saying and want to see also is, can we get this to a point where researchers can even mean, for example, me? I have no credentials for doing research in this field, but I have 100 peer-reviewed papers, and I run right now about 40 studies on the disease pseudoxanthoma elasticum. So I'm a different kind of researcher, not a traditional one. I want to be able to enable people like me and the other disease advocacy organizations. I also eventually, and my shorthand for this is, I want to enable smart Girl Scouts to be able to understand what this data holds and what can be done. We have seen in other industries like physics or fields like physics, astronomy, ornithology, entomology, individuals make enormous, enormous advances. And even in health and science, biomedical sciences, we see it. It's harder with clinical data because we don't want this data to fall into the hands of people who would abuse it or not use it properly. But we do want those smart people, whether they're young, whether they're old, whether they're traditional. The person who's folded the most proteins in the world is an older woman who comes home at night from being in a library and job and folds proteins and folded. So I think we want to see the same thing happen here. We're going to be very conservative at first, and only the traditional kinds of researchers and researchers who have been vetted by the disease info search organizations will be allowed in, but eventually we are working on figuring out who else and how else can people come to this site. Okay, I think we have a couple of more questions. I have a genetic test report for another disease, not breast cancer. Can I participate and free the data? Absolutely. So free the data is just the beginning of saying the proprietary databases of old that companies ran should be over, and we should be sharing human variation. This follows from the Supreme Court ruling on the Myriad patent. But the Supreme Court ruling on the Myriad patent does not free the data. The business model of Myriad and any other company can still be to keep those proprietary databases of information they've garnered from genetic testing, and that's true for all companies. And we're saying essentially, well, people own that information, and people can actually share that, and so we're asking for individuals to do that. We will make that very, very public after a while. We want to start out small and make sure we're doing this properly, but if today somebody with a genetic disease, genetic testing report wants to upload that report, we are ready and able to take it. And then a tiny preview, we are actually also building a viewer for the ClinVar information, so for this information that's in this ClinVar, which is part of the National Library of Medicine's databases, we're able, in fact, to give people a view of that information to allow the individuals to see it and to use it in a way that isn't terribly easy to do right now with ClinVar itself. So we'll be launching that shortly. Next question, what additional features will be added to Reg4ALL? Well, we have dreamed of lots of them. And the question will be, where will we find funding? How will we find funding? Who will help us get to our dream? And they certainly are things like full-blown hookups with the major electronic medical record providers, not just the blue button, which is a simple way to download information. They are, another feature I'd love to see is that individuals can find each other through it. And so, you know, my child's just been diagnosed with a very rare disorder, is a call Genetic Alliance gets practically daily. How can I find others with the disease? And we point them to the Inspire community. We point them to forums that might be related to that set of conditions or phenotypes. But wouldn't it be lovely to just enter your data here, give an indication that you're happy to, and your contact information with someone else who matches some set of the phenotypes that your child is experiencing. So those sorts of things are really important to us. And then matching tools that are more robust that use semantic web experiences. So we've begun to do this by hand, where you actually can use various search tools on the internet that start to help you understand where communities of individuals reside that may have conditions that are similar, or where people are talking about a condition that's not being well served, and how we can help to serve them better. And then we've also been asked, particularly by academics and major medical centers, if we can predict where there are loci of individuals with certain diseases, so they know where to put centers of excellence. And again, the software can easily do that because we can geolocate people with as far as they've allowed that with their privacy settings. And then I'm registered with a disease advocacy organization. Why would I join Reg4ALL? So I would say a couple things. One is, again, we're disease agnostic. So even though, you know, and I can talk again about PXE or pseudoxanthoma elasticum because I run that support group, lots of people, all the people, 4,000 have PXE, but another, I don't know, 300 have psoriasis, and another 400 have arthritis, and so on. I'm not meeting their needs with regard to arthritis and psoriasis and other things, and I really would love to. And so I encourage them to be part of this platform so that they are available for other kinds of studies or even as controls for other diseases. In addition, I think, and you can, those of you who are interested could go back and look at the Reg4ALL for disease advocacy organizations. We are offering this platform to disease groups to use all the bells and whistles of the gamified survey, as well as this privacy preference setting, to allow individuals to both belong to the disease group's registry and also to be able to be findable, discoverable beyond it, and to be part of setting up the question. So, you know, I love input from my 4,000 people with PXE, but it's hard to hear them all. And I only stumble, really, upon associations I should have made. And an example of that for me is in a support group meeting, 10 women sitting around the table 5 years ago said, every single time I have a mammogram, they make me have a biopsy as well because they think they're seeing the precursor to breast cancer or breast cancer calcifications. When I heard that, I started a study on mammograms and PXE, and I took 150 women's mammograms and 150 controls, and I did the study and showed that, in fact, every woman with PXE also has breast calcification. And we wrote a new standard of practice that said, you know, you don't have to biopsy every one of these women if it looks like this. This software allows us to hear that and to hear those associations in a really graphic way. It puts up histograms, essentially graphs, showing me that, wow, every woman with PXE has also had a breast biopsy after a mammogram. And that should make me start to think, wow, I need to do something about that for these people. I would say to people who already belong to a disease advocacy organization to talk to that advocacy organization and see if they want to be part of this, and also that there might be ways that they could start to show the organization, and not that the organization doesn't want to see, I want to see it all, but I don't have a way to find those associations, that in fact the software will start to show those associations, and that will be a very important thing that could be added. I think that's all I have. I have answered all the questions that have come in. I don't know if anyone has any more questions, and again, I apologize that we couldn't unmute everyone. I'll just wait another minute or so. Okay, looks like that's it. I want to thank everybody for attending. Certainly go to, and let me see if I can now get to the screen again of the other slide deck to show you where the other webinars coming up. So we have Registry for All and Companies. So we're looking at what can this do for industry on July 24th. Then we're going to talk about Genetic Alliance Rare Disease and Genetic Condition Support Community on Inspire. So we're very fortunate to be partnering with Inspire, and you'll hear from them that day. And then on August 21st, what is the future of Reg4ALL? And again, you can find all these webinars at geneticalliance.org/webinars. And we have so many webinars these days that you'll want to add /webinars.reg4all. so you can find these, although we certainly welcome you to all the other webinars that are going on as well. In fact, we're running a series on the Presidential Commission's report on privacy and whole genome sequencing, which certainly dovetails this as well. Whoops. Okay, so I want to thank everyone for attending. This is recorded and archived as well as all the others, and just certainly send us an email, give us a ring if you have any questions. We're really excited to get this out and rolling. Thank you all.